Hey, it's Dr. Modi from Gastro Office. It's March, and I know for a lot of people that means filling out your bracket and following March Madness. But for us GI docs, I also think it's important to recognize it's Colon Cancer Awareness Month. So I wanted to spend some time talking about screening options for colon cancer. Now, there's so many options now. You can do a FIT test, a Cologuard, a CT specialized scan, or even a colonoscopy. So, for me, and I think all of my colleagues would agree that any screening is better than none. And so if you're a patient who feels that a colonoscopy is too invasive or can't tolerate the prep, a viable option is doing the other options, right? Now, I have a lot of patients who come to me and they have a Cologuard positive test. And, I try to reassure them that the risk of cancer with a positive Cologuard test, the studies show is about 4%, but in my clinical practice, I would say it's even less than that. And usually it's a type of polyp that needs to be removed. Now, a polyp is abnormal tissue that can turn into cancer, not today or tomorrow, but over the course of 5 to 10 years. And that's why we remove them at time of exam. And so for me, the benefit of doing a colonoscopy for a patient would be that if we see any precancerous polyps, or any polyps for that matter, we can remove them and look at them under the microscope. Now, there are certain people who would benefit from a colonoscopy rather than other modalities of screening. Those patients include people with prior histories of precancerous polyps, family members with colon cancer, especially first-degree relatives. So that includes siblings and parents. Anyone, who has had a first-degree relative with colon cancer should have a colonoscopy every 5 years. And then the last one, to think about are the patients that maybe are a little too sick to have a colonoscopy. I think it's not unreasonable to consider doing a Cologuard test or a FIT test, and talking to your primary care doctor. But it's really important to remember that if that test comes back positive, you will need a colonoscopy. And so I just, I always remind people is that there's, no right or wrong answer, and the decision is really yours. But I encourage you and your family members to definitely get a colonoscopy, or at least talk to us or your primary doctor about it too. All right. Take care.